Hello, I am Dr. John Rowland. I'm with Evolution Medicine. I have a local practice in Rockwall. I am at the Chamber of Commerce today to educate people about local resources regarding COVID-19 crisis. We're going to be talking about testing. We're talking about the availability of vaccines, where you go to do it, and there's no one, in my opinion, better to ask those questions than Judge Sweet. And Judge, I want to tell you, there's been your guidance through all of this crisis has been just amazing, and we're so lucky to have you as one of our leaders. And I really much appreciate you being here and helping to answer these questions in this tough time.
Yes, well, thank you very much. I appreciate that. I can tell you that it's absolutely been the toughest thing that I've gone through as an elected official, and it seems like it's never ending, and it's definitely been tougher than what I could have even imagined. But just part of it comes with the turf. There's a lot of folks that have had it worse than I have. That's for sure. And I'm very, very sensitive to that. As far as my family is concerned, both of my boys, both of my sons have recovered from COVID. They were,
really?
Yes, sir. They were both symptomatic, dealing with. No, they weren't over the top or some of these worst cases that so many have had. But definitely dealt with the loss of taste, loss of smell, fever, fatigue, all of that good stuff, and down for a couple of weeks. Good news is they've recovered. But very close friends of mine, one that's just recovered from it recently, and family, close friends. I think her mother spent some time in the hospital. Got another buddy of mine that very interesting, because this virus has just been something else as far as an impact is concerned. A very, very good friend of mine that son tested positive, had the virus and was symptomatic early on. His dad, his mother, and his sister did not get sick at that time. He recovers. A few weeks later, the dad gets it so bad he spends time in the hospital and is recovering. And once again, wife and daughter do not end up with the virus. Directly those that have been impacted, whether you've lost loved ones, you've had loved ones that are sick or currently in the hospital or have recovered. Just an unbelievable. Then you talk about the indirect impact, those that have been financially impacted,
yes,
that have lost businesses, that business has been negatively impacted to, as I said, job losses or kids. I had a senior, my son graduated last year, his entire senior year thrown upside down, and got one that's a freshman that's having to navigate some tough time for kids to be in school, to seniors that have been in
Going through virtually, yeah.
Absolutely. Senior citizens that have been, we've had so many facilities here in our county that have been, that dealt with virus outbreaks, to separation from loved ones, isolated in some of those facilities, in those facilities, to healthcare workers, first responders, you name it. The list goes on and on and on.
Well, there's not a side of our existence that hasn't been touched by this.
Absolutely.
As you know, I work some as an emergency room doctor, as well as having a private clinic, and yes, it's doesn't touch some people, and then others it rips through their family and distorts everything. Absolutely. So it's really been a challenge. So this does come at you, sir, 24/7. How have you been able to, are you getting enough rest? Are you doing okay?
I've talked about the fact that it kind of goes in peaks and valleys. Early on, of course, it's like anything else, we've been punched in the mouth and trying to navigate, trying to figure out what's all going on. We called it early on being able to establish a battle rhythm, being able to recover, kind of assess what's going on around you, and then begin to realize it's going to be a daily battle. This is not going to be a sprint. It's going to be a marathon. You can go on with so many cliches, but we kind of established that battle rhythm. And sometimes days have been longer, more hours, and and all the good kind of stuff, but I go back to saying that's just part of it, and part of the turf. And I've had some really, really good people that I'll brag about as we kind of walk through this that have been part of that. But one of the things that we did early on that made it a little easier on me and those that I'm working with,
Yes.
that I've been working with, is being able to identify priorities. There's so much of this. That we can't, it's at least a challenge or tough to be able to control. Some of it, we're just not gonna control. So we had to identify goals and things that we could absolutely control. And one of those was accurate, easily accessible, reliable, and timely information. I'll talk about that here in a second with the COVID dashboard and our vaccine information, to adequate levels of personal protective equipment for our first responders and healthcare providers. Testing, being able to access public testing.
Yes.
Early on, you heard, of course, we heard the president talking about public testing is available. I'm kind of looking over my shoulder trying to find it on the level. It took a long time for us to be able to find that, but we were able to pursue, again, talk about that in a couple of minutes. We'll talk about public testing, about our success in being able to obtain that, to vaccines being the same thing. And vaccines have kind of followed the same pathway or trajectory as far as public testing is concerned. But I've got some good news that I'll share in a minute with vaccine. But identifying priorities and being able to keep our team focused on those objectives has been some of the key to make it a little bit easier.
Well, and I think the public is starting to realize that this is really starting to ramp up, and we're starting to meet the challenge. So the first question I have is about testing and the ramping up of testing, which we've seen. For those that need testing, what do you suggest currently?
Absolutely. I'll be glad to answer that. If I can, I'm going to direct folks to where to go. I want you to go to the Rockwall County website, and up at the top of that page, there's a COVID dashboard. COVID dashboard, and this is all things COVID, and specifically to answer your question, there's a link down on the bottom left of the page there for registration for free testing at Lake Point Church and Roy City High School. Those have been, if you follow that link, you're able to register, and in most cases, definitely now, as far as this time frame is concerned, you can get in there pretty easily.
Yes.
7 days a week at Lake Point, Monday through Friday at the Roy City location.
And I used to see long lines
Absolutely.
there, and now I'm not. So the availability to get in and get testing, I mean, that was part of the impediment. People were getting sick and, oh my gosh, it's so hard to get tested, but now it's much easier. And I can tell you as a primary care doctor, it's much easier to start tracking what's going on in the family once we have that index case.
Makes perfect sense. You talk about as far as those that took advantage of it early on, we were running about 3,000 or more per week. And we had the Lake Point facility was the first testing site, and it was the second busiest site throughout the region. There was only 10 public testing sites in this region. And because of as busy as that location was, that's how we ended up with the Roy City location. But those are both still up. Again, Lake Point, available 7 days a week. Roy City ISD's football stadium, 5 days a week. There's a link on the COVID dashboard for folks to sign up to.
So, as far as barriers of getting testing, we have locations now. How about cost? What if you need a test? How much does it cost?
No, those are free.
Those two locations?
Those two locations are
completely free?
Absolutely. Absolutely.
Now, do they interact with your insurance company? What if you have insurance? What if you don't have insurance?
No, sir. Either one of those two testing locations. Testing is, you register to be able to receive that test, and they'll assign you the little code, and you pull in there at your time, and
fascinating.
And they're going to perform that test for you.
So the barrier to testing is now really resolved.
Absolutely.
Absolutely. So vaccinations now starting to go through the society. We've got our first responders covered. Now we're starting to hit the high-risk people in our society. What is the availability of vaccinations now?
If I can, I want to kind of take you through the story a little bit of where we were and how we got where we're at, to answer that question, if that's okay.
Absolutely.
254 counties in the state of Texas, we were all given the same direction originally, and that was to work with your local healthcare providers and pharmacies and encourage, support, nudge, if you will, them to be able to register, to be able to administer the vaccine. We were very aggressive with that, had 21 approved healthcare providers and 12 pharmacies that, and no surprise in Rockwall County that folks would respond that way and be very responsible. We, again, 21 healthcare providers and 12 pharmacies that followed that lead and were able to do that. After that, the decision was made, which you can follow. It's very easy to understand trying to get that many vaccines done at that amount of time. That's where those hubs were created. And where would you start with that? Highly populated areas. And there were 28 hubs that were created. And it took a little while to be able to open the faucet for vaccines.
28 hubs,
28 hubs in the state of Texas.
Okay.
In large, highly populated areas or places that were isolated in the middle of the county. And it took a while for that to kind of spread and open up, but we were able to identify partners here in the county that were capable and willing to operate as a mass vax location under the county's umbrella. Helping Hands has been a very, very good partner. Yes. That's not a surprise to anyone in Rockwall County that they're always answer the call and step up.
And they vaccinate at their location?
No, we've been able to, they've done some of their vaccines in their health clinic. Okay. But we've assigned the Rockwall County Library for those guys to be able to operate. They can handle 200 or something out of that clinic, but when we start getting into these big numbers, we needed a larger location.
I see.
So we've assigned the Rockwall County Library, and they've been able to, they were allocated 400 Moderna, 200 Moderna a second time, and we're able to get 667 folks vaccinated. They've already taken care of the second dose last week. They were assigned 975 Pfizers at one time. We're able to get 1,063 doses out of that, and this week, as a matter of fact, right now, yesterday and today, they've been administering the second dose of vaccines. They've been very successful, or very good partners in taking care of Reese Manor, the Housing Authority's project here in a senior facility in Rockwall County, and able to take care of Liberty Heights, one of our senior facilities. So that's one of our partners, Helping Hands. Rockwall Health Authority, Dr. Parrott, and Rockwall County Office of Emergency Management. They're another one that went through that process to be able to administer the vaccine. They were allocated 1,000 vaccines, and we were through partnership. So thankful for First United Methodist Church of Rockwall that they allowed us to use their facility this past Saturday, and 1,200 of the Moderna vaccines, first doses, were administered at First United Methodist Church. Rockwall Fire Department, they operate out at Lakeshore Church, another fine partner that's opened their facility. And we've had, one time we had 500 Modernas that were allocated, and we were able to get 615 vaccinations out of that. 1,000 Modernas the second time, with 1,200 vaccinations to another 1,000. We got 1,140. This week we received 3,510 vaccinations, and they were able to, so brag on them for a moment. They operated a clinic on Friday, then we had the Health Authority on Saturday, back to Lakeshore with the fire department on Monday, and today back out there again. We're able to knock out 800 vaccines, and then right now they're over at the Evergreen Senior Facility administering first doses. So been very successful with that.
And I understand that's the last senior citizen facility in Rockwall County
Absolutely.
To need vaccination.
Yes, sir. Again,
so all of them are now vaccinated.
With Helping Hands taking care of Reese Manor and Liberty Heights, Evergreen being handled by the fire department, and then through a federal pharmacy initiative, all 12 of our long-term care facilities here in the county have been completed. First dose and second dose have been administered to residents and staff that chose to participate. And here in Rockwall County, CVS and Walgreens were with the partners assigned to accomplish that task. But yeah, and I'm very proud of those efforts.
Absolutely.
That was successful.
So if, now you don't go specifically to those locations, you sign up through your website and get registered.
Correct.
And then you will get assigned a location and a time, correct?
Correct. So folks just need to very simply to go to the Rockwall County website, and up at the top of the page, click on the vaccine link, and you're gonna see a sign-up sheet that's gonna pop up. It'll be the first link to pop up after you click on that link, basically. And Helping Hands was an outstanding partner. They helped create that original sign-up list there. And then all of our mass vax, if you go and sign up on that list, all of our mass vax opportunities, again, with Helping Hands, the fire department, the Health Authority and Office of Emergency Management, we're all utilizing that list. So go to Rockwall County's website, vaccine link, first link, sign up sheet, sign up on that to receive the vaccine.
Now, there are all sorts of independent providers
Absolutely.
too.
Absolutely.
There are private doctors that are doing it. There are some pharmacies that are doing it. And so as individuals, we may come across another provider. You may find something on the web, as you do your scans on the internet, another local place that you can get in.
Take full advantage of it. The whole
Take
objective
advantage.
in this is to be able to find access to and to be able to get that vaccine. And so I want to encourage people to be able to do that, not just here in Rockwall County. Don't go only on our website and sign up for the there's no residency restrictions at any of the mass vax locations. So sign up on as many counties as you want. I've visited with people that have been at our sites that have been from all around. And so I want to encourage folks to do that. Obviously, same thing with CVS and Walgreens. I'll brag for 1 second before we switch page, because this is very, very important. As far as numbers are concerned, and again, I think you guys are going to pop this link up in Rockwall County. There have been, as of today, 14,453 folks that have received at least one dose. And out of those eligible to receive a vaccine, those 16 and over, not just within the first two tiers, but in the 16 and over, 18% of those eligible to receive the vaccine have received the first dose. And out of all of North Texas, that's the highest percent.
That's the highest percentage.
Highest percentage of any county in North Texas. Collin County's right there with us, but we're beating them by a little bit. So,
you know, that's very encouraging, because initially there was a lot of worry about vaccinations. Even in the medical field, there have been some people that have been reluctant and worried and concerned about vaccines. And we're not seeing big problems with vaccines. And for this to be effective, we need to vaccinate the mass of the population.
Absolutely. 18% in one sense, again, comparing ourselves to where you got to gauge yourself somewhere.
Yeah.
But then you pause for a second and say, there's still a lot of work ahead, but we'll get there. We'll get there.
What if you're not high risk? What would you advise? Because there are a lot of our personnel that are citizens that are worried and want the vaccine.
You bet. You bet. First of all, again, first two tiers, that's an automatic. You're eligible for those vaccines if you fall into those two first categories. But today, as of this afternoon, teachers, and I want to make sure that I word that properly, the way that it was worded, but directive that came out from Texas Health and Human Services this afternoon, those who work in pre-primary, primary, secondary schools, as well as Head Start and Early Start programs, including teachers, staff, and bus drivers, and those who work as or for licensed child care providers, including center-based and family care providers, they're immediately eligible. So there's another group that is eligible to receive that vaccine.
We've got to protect our teachers.
Absolutely. And we have sent out a link. We sent out to our Office of Emergency Management team after conversations with Dr. V with Rockwall ISD Mr. Worthy out in Roy City ISD, and we sent out a link this afternoon, early this afternoon to see who wants to receive those vaccines, and they've got a link that they'll be able to sign up to. And then your question was the others, and I completely get it, and extremely sensitive towards that, and we know that we're in for the long haul. So as those tiers open up, we'll again make sure that we're reaching out and asking folks to be able to register to receive that vaccine.
And I've had friends that haven't quite met the high risk criteria, and with persistence, there are some locations that they find.
Absolutely.
And at the end of the day, there are people that don't show, and they do have extra vaccinations.
Absolutely.
So,
Absolutely.
being diligent and continuing to watch
Yes, sir.
and look. Excellent. Is there any cost to getting vaccinated?
So in some of these sites, if there's groups, in the hub business, some of those hubs, those are staffed and all that good kind of stuff. With us, the vaccines have just been, we've received the vaccines and syringes here in the county from whatever different organization that has stepped up and answered the call, answered the charge to be able to administer those. They do have, Star Wellness is a partner with the city of Rockwall that provides the vast majority of the vaccines under the fire department. Med Labs at the Health Authority Office of Emergency Management site. They can charge an administrative fee of $25 to your insurance provider. But if you don't have insurance or anything like that, there's no cost out of pocket. So, but they
We're not
can charge
making
an
that a
administrative
barrier.
fee. No, absolutely not. It is
So
not
if you
a
don't
profit
have
generator.
insurance, you can still get vaccinated.
100%, absolutely.
Are they making provisions if you get the first one that you can get the second one?
Yeah, that makes a little bit of a challenge. That's been very, very trying. Helping Hands this week has, beginning of the week, out of the clinic, administered the second dose of some of the Moderna vaccines, I think all of the Moderna vaccines, and then yesterday and today, they were administering the Pfizer vaccines at the Rockwall County Library. It'll be time for second doses to be administered to some of those that were provided to the fire department, and they'll go on next week out of Lakeshore Church, and you'll receive notifications. So yes, we're kind of planning as we go. But yeah, we're receiving your automatic, the group, who's ever provided that first dose of the vaccine is automatically receiving the second dose, and then they're going back and scheduling with you your appointment.
So as we go forward, we'll be having more opportunities to get vaccinations, and easier to get through the line, and so to get your vaccination done.
I think we've got a big pop. We've got some details to be able to work out, but we do think that we popped and been assigned a hub. Don't know when that will start, but looks like we're
So this is in the future, perhaps.
Could be very, very soon. And through our working with some of my counterparts with Department of Health and Human Services, Barbara and her team with emergency management, and Dr. Parrott's been very helpful with us as our health authority, and working with folks on the regional level, that we think we've got a hub popped, and we're working with Rockwall ISD. That we're probably going to be able to, we'll get it done, and we'll end up with a hub site over at Wilkerson Sanders Stadium here in the future. So hang on for more details on that. But this is going to be a game changer, So that'll be very good news.
So what advice would you give our community leaders about
To our community,
position?
our community leaders, continuing to stay the course, encourage folks to sign up to specifically here in Rockwall County, again, to go to our website and to sign up for that vaccine, but don't miss any opportunities. Don't miss any opportunities. All of this information is public on that Department of Health and Human Services vaccine dashboard. You can see allocations from week one. And when it comes out on Friday, then it pops up, and you can see what vaccines are going to what counties, and what group that's, that.
And again, we have
Sign up.
individuals that may all of a sudden get vaccines, and you may walk into a location and they may be offering it.
Absolutely.
And, if you can get vaccinated,
Please do
it
it.
benefits all of us.
Please do it.
Do you have any closing comments
Yeah, I
that
just
you'd
want
like to make?
I do want to take an opportunity to be able to thank a lot of folks. Again, this has been a significant level of challenge, but there are so many people in our community that have stepped up to answer the call. Thank you to Rockwall County Office of Emergency Management, Barbara Neville, Jared Ross, and Clay Taylor. Dr. Parrott, the Rockwall County's Health Authority, Rockwall Fire Department, Rockwall City employees that have been so very helpful in staffing several of these locations, as well as Rockwall County IT Department, Facilities Department, Rockwall County Helping Hands, Lakeshore Church, First United Methodist Church, Roy City ISD has been an outstanding partner with us, again, making their facility available for testing to, and obviously Rockwall ISD as we look forward to getting this hub up and working. To so many volunteers from CERT to Citizens on Patrol. There's been so many folks, and I guarantee you I'm leaving somebody out. In addition to many other volunteers within our community. Just a big thank you to everyone for their hard work.
Well, and as a general rule, I would urge people, God forbid that you do get COVID, there are lots of things that can be done about it, and reach out to your local physician.
Yes, sir.
And interview with them. Many of them are seeing people virtually. There's lots of things that can be done. Judge, I know I'm not the only one to feel this way, but as a chamber member and a citizen of Rockwall County, your leadership has been so beneficial to us. And the things that you've been working on are really helping us, and we really appreciate it.
Well, thank you, sir. There's been lots of folks that have been very actively involved since day one, but thank you so much. Appreciate it.
We will continue to bring you information pertinent to local resources and things that you can do in your community to help us all. We will bring that to you, and thank you very much for tuning in.